Today I will be talking on a topic called as intensive care management in patients with end-stage liver disease. At the outset, we'll have to understand what do we mean by end-stage liver disease, what we scientifically call as cirrhosis of liver. Cirrhosis of liver is called when there is an architectural change in the liver as well as there is loss of functionality of the liver. The main reasons for cirrhosis of liver would be alcohol-related diseases, autoimmune disorders, certain infective disorders like hepatitis B and hepatitis C. There are certain conditions like fatty liver, which is related to metabolic syndrome where there is excessive deposition of fat in the hepatocytes, and that leads to a permanent damage in the liver, causing scarring of the liver, which later down the line becomes cirrhosis. So there are certain complications which are associated with liver disease with which the patients routinely present to hospital and might require ICU care. These complications, which are a sequelae to liver diseases, can be GI bleed, which normally manifests as blood in the vomiting or black stools. Patient can present with altered sensorium, which may be related to hepatic encephalopathy. These patients can present with high-grade fever associated with anasarca, which is generalized accumulation of fluids predominantly in the abdomen, and which undergoes spontaneous bacterial infections, which is called as spontaneous bacterial peritonitis, which again is a gastrointestinal emergency for which the patients require an ICU care. Majority of these patients are asthenic because of chronic catabolic state and poor intake of proteins. They are nutritionally debilitated and there is a loss of muscle mass. So this is one major aspect which needs to be addressed in patients who have chronic liver disease and are admitted in ICU. Since they are poorly built, have poor muscle mass, chances of them acquiring hospital-acquired or ICU-acquired infections is very high. Any person with cirrhosis who presents with GI bleed needs to undergo emergency endoscopy in which varicose ligation or sclerotherapy of the varices is to be done. They are to be started on certain drugs which decrease the portal pressures and thereby preventing varicose bleed again. They need to be monitored in ICU for next 72 hours because of high chances of recurrence of bleeds. The second major complication for which the patients are admitted in ICU is altered sensorium. When the patient might come, this is again graded into grade 2, grade 3, grade 4. The grade 4 hepatic encephalopathy, the patient is totally comatose and does not respond to any painful stimuli. In grade 2 to 3, the patients are delirious, that means they are agitated, they do not respond properly and they are incoherent. This complications normally arises in patients with cirrhosis because of excessive accumulation of ammonia in the blood, which goes into the central circulation and reaches brain and leads to cerebral edema. This again is a medical emergency which needs to be tackled in ICU. The patients have to be put on elective intubation so as to prevent chances of aspiration. There are certain drugs which can be given orally as well as IV formulations to decrease ammonia levels, and the moment ammonia levels start coming down and the brain edema goes down, the patient tends to improve. There are certain drugs which can be used and the patient needs to be closely monitored.